overall, this is what our presentation will consist of. We'll discuss evidence-based treatment or intervention with children with autistic spectrum disorder. We're going to provide a background of pivotal response treatment, and we're also going to describe some pivotal areas, and as well as discuss some treatment strategies based on pivotal response treatment. So intervention for autism spectrum disorder, the effective treatments are based on applied behavior analysis. And this is a field in psychology and other areas where the focus is on changing individuals' behavior. For us, what we're looking at is focusing on the impairments that are part of a diagnosis for a child or a person with autism spectrum disorder. And those areas that we're concerned about are socialization, communication, and restricted or repetitive behaviors or interests. Interventions for autism, as I said, applied behavior analysis is what's considered to be evidence-based, and it follows a principle that in order to understand behavior, you have to know the environmental context. So you have to know what happened before, or the antecedent. You have to know what the person did, what their behavior was, and you need to know what happened after, or what the consequence is. A lot of what you're going to see in terms of what we talk about pivotal response treatment include what we call the ABCs, the antecedent, behavior, and consequence. There are a lot of terms, and I thought it would be helpful for people to hear different terms that people use when they're talking about behavioral intervention, especially intensive, just so that you're aware when the literature or you're reading about something. The term ABA is something people have heard all by itself, and it does stand for Applied Behavior Analysis. And that really is a whole field where people are studying behavior and trying to understand what happened before and what happened after. This is a field that is not just for children with autism. There are smoking programs, there's eating programs, or weight loss based on applied behavior analysis, family therapy based on applied behavior analysis. So it's a very large field, and it has been shown to be effective for kids with autism with specific strategies. The term IBI, or intensive behavior intervention, refers to a period where it was recognized that in order for this type of treatment to be effective for kids with autism, it was really important that we spend a good number of time, one-to-one or intensively with them. That we can't just say, well, we'll do this every once in a while or when we feel like it. It has to be a set number of hours, and needs to really be done during all the waking hours for a child. The EIBI stands for Early Intensive Behavioral Intervention, and really focuses on the idea that the earlier you start to work with these children, the better the outcomes are. That the earlier you work with them, the less they're able to, or the less they're going to build up histories or behavior issues or just ways and habits of doing things. So just like all of us, we think of any skill you've learned, if someone taught you the right way first, aren't you better later, right? Until, or you find out nope, and you have to relearn a whole bunch of things. It's a lot harder to correct your mistakes later. So the early aspect is something that, that in terms of working with children, the earlier the better. We don't know exactly how old a child is. I would say, because I know adults respond very well to applied behavior analysis, I know that at any point it will be effective for an individual, but we just assume that the earlier we start working with this method, the better. Pivotal response treatment is based on applied behavior analysis, so it's another term. PRT is another term that you guys will hear, but it is an applied behavior analysis, and we want to make sure that everyone realizes it's just one type. It was developed by Drs. Robert and Lynn Cagle from the University of California, Santa Barbara, and Laura Schreibman, who's from University of California, San Diego. They had actually worked both of them had worked together with a man named Ivar Lovaas, who was one of the first psychologists, well, I think he's a psychologist, first people anyway, to really focus on working with kids with autism and using applied behavior analysis. Okay, so now I'm going to get into some heavy stuff, but nobody, if there's any questions, I want people to feel free to ask. Overall, there are two approaches that when we're working with kids with autism, these are two approaches that are often common for kids with autism. And I wanted to make sure we just talked a little bit about them so that people could realize that there are some differences, but there are also, as you'll see, some similarities too. For a common what's called discrete trial, it's again, this is all about the antecedents, behavior, consequence. Somebody wants a child to do something different, so we either change what happens before or we change what happens after. In a common discrete trial and pivotal response treatment, both are based on that ABC model. Both are looking to change behaviors, teach new behaviors. With a common type of discrete trial, it will often be led by the teacher or by the adult. So the adult decides, I'm going to teach this child his colors, and that's what we're going to do today, and we're going to sit down and learn about colors. In pivotal response treatment, we're often looking to find out what are the child's interests. And I might be able to teach them about colors, but I'm looking to see what is this child interested in. If they're interested in balloons, I've got tons of colors there. And I can work on the fact that they're interested in balloons, but I can also work on some other principles. But I'm really looking, what is that child interested in, versus me coming in with my color program. This is what I'm going to teach you. These are the steps you're going to follow, and hopefully you'll be able to follow this program. So we really watch to see where the children, their interests are, and use that to our advantage in teaching them. With the common discrete trial, they'll also look at individual behaviors. You need to learn how to discriminate colors. You need to learn how to problem solve around puzzles, those kinds of things. And people will look at a list of different types of behaviors that they want to teach a child. In pivotal response, the idea is we're going to look for something we're going to look for behaviors or areas to intervene where it's going to impact on other behaviors. A good example is, and I'm sure people have experienced this, when you really focus on teaching a child communication, it's amazing that types of disruptive behavior can decrease, their affect can change, they might actually look at you more. So you can just target one area and other areas are impacted. And that's the underlying assumption with pivotal response treatment, is that over time with research we'll get a better understanding of behavior and figure out what are those critical behaviors we need to tackle that will have the most impact for a child at any one time. The common discrete trial will use a lot of repetitive teaching, so that you'll do 10 trials in a row of a certain type of problem solving. You might do 10 puzzle pieces, or 10 trials at discriminating colors, or 10 repetitions of a word that I want you to learn. And I'm sure all of us have, I know I have anyway, I definitely have been exposed to learning in a way where you get practice by doing it over and over and over. So that's one common feature of discrete trial. Whereas in pivotal response treatment, they've actually used some research that suggests if you vary up what you're doing, the child will still learn. So you can get out the balloons and find out a color, and then you can work on a puzzle, and then you can move over and work on something else. So you don't have to go with each task repetitively one after the other. You can actually vary it, and sometimes it will actually increase the child's interest and motivation. They're actually more interested to be, because they're not going, oh, not another puzzle piece, right, or not another whatever. So it has been helpful. With discrete trial, common discrete trial, they will modify some of the materials, because when you have your, say you want to learn about what is a cup, you might need a lot of different examples of what a cup is, and you might be working on identifying that. In the pivotal response treatment, we're just looking in your cupboards. We're just finding out what the cups are that are in your cupboards, because those are the cups that this child's going to be exposed to. And we're going to make sure they understand that the label of cup or asking for a cup is going to get them something they're familiar with. There's really good reasons for both of these, so I don't want anybody to think I'm criticizing that. There actually were really good reasons why in the common discrete trial they would actually think, okay, I want to make sure that I have all sorts of different examples so that this child will be able to generalize. In pivotal response treatment, they actually found that it wasn't as critical for these children, or at least all of them, not all of them, to make sure you looked around and just looked at what was their environment and used what was already in their environment. Edible is another thing with common discrete trial, is edible paired with social reinforcers. So when you get something right, the child would know, because you'd be able to give them their favorite treat or something that they could eat, and then also, socially praise them. And that's been found to be a very effective method with children, and actually with me too. That if I do something right and somebody gives me a piece of snow crab, we'll continue to do that more and more often. So on the other hand, it's also been shown that there is at least one article that I'm aware of that the Kegels were involved in. They actually compared the difference between using something that is separate from the task, like if the snow crab has nothing to do with me discussing or coming up here and talking with you. I would talk more though if you gave me snow crab. I have to admit that. But it's not really related. That's nothing to do with my talk here. Now I can't really think about the natural reinforcer is for this, but it might be your attention. So we're always looking for the children. We found that in the research they were saying that if you had something that was related to the task, the children seemed to actually respond faster. So if you were talking about juice, then getting a drink of juice was a more effective way to learn about juice than it was to look at a picture, this is juice and this is a picture of milk and this is what, that actually getting a drink of juice was relevant, and the children responded faster. And again, these are still paired, that even when if a child said juice and I gave them a cup of juice, I'd still pair that with, yes, juice, and give them lots of my attention for that, so that they're seeing me as part of this interaction. As well, you would do that in common discrete trial. In common discrete trial, once the skill's taught, you then bring it into the natural environment. So then you make sure that you're doing it with different people, you're making sure that it's in a different environment, and that it's done with different activities. So it starts off with needing to do it maybe in a more controlled environment, and then moving out into the natural environment. With pivotal response treatment, they are going on the assumption that many of these children have a very difficult time generalizing. They have a hard time learning something here and then taking it and doing it somewhere else without a lot of teaching. So the Kegels recognized this and thought, well, why don't we just start in that environment that they're already working in? And if it's necessary to pull them out into a more controlled environment, we can do that. But let's start there and make sure the behaviors that we want are happening already in their natural environment. What their assumption is that the children will not only get exposed to the consequences that we artificially apply, like, I don't walk around with juice all the time, so I might make sure I'm doing it because we're working on it, but they're also being exposed to the fact that we're in a kitchen, that we're near a fridge, that it's around snack time. So they start to associate the other things in the natural environment, that the word juice other people will understand what this child will want from it. So that's just a little bit of the boring part. Now, having said all that, I just want people to be aware that the National Research Council did report that both the structured or the common discrete trial and the naturalistic approaches are both effective. They're effective in increasing communication, peer and other social interactions, and reducing problem behaviors. One of the reasons I wanted to talk a little bit about this is that I know in this community in Halifax, and I'm sure in other areas as well, There are different approaches done by treatment providers. There could be private psychologists, or in our program EIBA we do PRT, but there are also other providers, and that they're going to do either the common discrete or they're going to do PRT. And we wanted you to realize that though I might have a preference and a bias towards PRT because that's what I do, that really it has been shown that both work. Pivotal response treatment was developed to increase the social and communication skills of children with autistic spectrum disorder, or ASD. They use positive techniques to change behavior and develop skills. So we're really looking for what's motivating a child, what interests a child, and trying to make sure that the behaviors around that interest, around that motivation increase, and that adaptive behaviors are occurring. The pivotal approach assumes that if one area is targeted, that other collateral gains will be made. And that's what I was saying earlier. If you're able to teach one behavior, you might find that other behaviors come along with it. It's still, just so you're aware, it's still very much on the research end, in that people are always looking, especially people who are interested in pivotal response, are looking what are those pivotal areas. And there's been lots of discussion and agreement and disagreement. Some people have suggested that joint attention, that really looking at you, or looking at an object and then looking at you, looking at the object and looking at you, those kinds of things are ways we communicate. And some people have said if you target that joint attention, that will be pivotal, and the child will learn so many other things just by you targeting that. But there is also, the Kegels also have done some work where they've found that if you teach communication, functional communication to children, that the joint attention comes along and you don't have to target it. You don't have to say, look at me. You don't have to take the toy and go, hey, I'm over here, that kind of thing. That the child, when you just hold on to the toy and the child notices you got it and they come towards you and you're able to get them to make a word or a sound for that, they start to look for you more often, and they start to look at you more often. Now, having said that, I also just want to be fair as well in that there are some kids that we might think, okay, I'm going to teach him this communication, and then he doesn't give us any joint attention. He doesn't look at us at all. And so we might have to target those areas. So it really still is very much, even though overall we're looking and we know that there's some pivotal areas that are very important, which we'll talk about, we also recognize that not all children respond the same, and that we're always tailoring whatever we're doing to how that child is responding to us. The pivotal areas that we're going to talk, there are other pivotal areas that the Kegels have identified, and that Laura Schreiben has also identified, but the two main ones we're going to talk about today are increasing motivation and developing self-initiated learning. I'll tell you a little bit more about that. Motivation is something that children with autism have been found to have less of. That often their interests can be very narrow. They may not be exploring their environment as typical children would, and they aren't seeking out a lot of information from their environment. And as a result, one of the focuses for a program working with children with autism needs to focus on them responding to the social and environmental cues that are around them. When children with autism are motivated, and that's what I'm really talking about, is are they interested in what's happening? The more they're interested in something, the more they find something interesting, the more you can work with them around whatever it is. And when you do that, they respond more often, they respond quickly, and they seem happier. They seem really to be more engaged.
Okay.
Oh, thank you, Caitlin.
Okay, so as Dorothy mentioned, motivation is really, it's a pivotal area, and what we mean by that, it's a really important area to look at when we're trying to help your children with autism learn. And what the Kegels have done, which has been really helpful for us in the early intensive behavioral intervention program, is they outlined what they call motivational procedures. And all that really means is, what do we do before we get our child to speak, and what do we do afterwards? And really look at that to help them learn to communicate more often, more clearly, and most importantly, more functionally. So we've really benefited from the work they've done in those areas. The first piece Dorothy mentioned is child choice, and that means really looking to see what your child is motivated to talk about, and I'll talk a little bit more about that, but it's a really important piece to just watch and see what do they like to do and use that to help them learn. Another motivational procedure is varying the task, so changing things up, keeping it interesting. We know for our own learning, if you do the same thing again and again, it can kind of get boring, and you don't tune in and respond as well. So mixing it up and keeping the learning interesting for them. Another piece that's really important that sometimes I think is overlooked is with our own best intentions. We want them to learn everything right away, and what we forget about is balancing what's easy and what's already learned and what's more difficult and challenging for them, so that they're not getting frustrated and they're feeling like, yes, this is actually something I can do. So keeping that balance. Another piece that's really important that I think we've all benefited a lot from when we learned PRT was the idea of teaching that positive consequences follow when you do the behavior that we want you to do. So when I use my words, good things happen, and we'll talk a little bit more about that. Another piece is reinforcing attempts, so reinforcing their good effort at trying to do this thing that's pretty hard for them to do, and using a natural reinforcer. So like Dorothy mentioned, I say juice, I get juice. I say ball, I get a ball. So making sure that there's that connection there for them. Okay, so the first piece is child choice, and this is something that I think sometimes we overlook when we're trying to help our kids learn, but really it's quite an important area to look at. We know that the kids are better able to learn, and they want to learn if there's something good in it for them. So one of the things that we try to do is become really good at watching and watching the kids to see what do they naturally go towards, and then using that to help them learn to communicate. So what I mean is, your little girl might love Dora, she might love puzzles, she might love TV. And if that's the case, then that's great, because it's kind of more obvious for you. You know, there's lots of different interests that they can go towards. Some of the kids we work with, and probably some of your own children, it's more difficult to find out what they're motivated to talk about and what they're motivated to engage in. So just to watch them. It might be that they're motivated to play with a string. It might be that they're motivated to spin. It might be that they're motivated to look out the window or run. So everybody's motivated by something, and it's for us to really look at and try to understand what motivates that individual child, and then using that to help them learn. So like Dorothy mentioned, not all kids are going to be motivated to learn from flashcards. You know, blue card, red card, blue card, green card, and getting them to respond. You know, some children that works, but a lot of children that doesn't work, and that, you know, that would apply whether we're talking about children with autism or typically developing children. That's not always that much fun for kids. So rather than doing that, looking at you know, the example of maybe using blocks. And if you want to teach them colors, blue block, red block, green block. So, you know, using what they're motivated to communicate and work for. Another piece that's really helpful for us, and I know that there are some preschool staff here that we've worked with, and probably some others that I haven't had a chance yet to work with, and one of the big things that's been helpful for us is how do we provide these children with choices and some control and situations. You know, one routine that I don't know particularly is challenging for the kids is circle time. And for those of you who aren't in preschool environment, circle is when you sit down and you do stories and songs and that sort of thing. And I don't know, there's been an umpteenth number of children in our program who don't naturally love circle time, so they're running away and they're leaving. And one of the things that we find really helpful is trying to think about, okay, let's give them some sort of choice here. They can sit on the blue mat or the green mat. They can sit beside Maggie or John. And they're making that choice. They have some control over what we're asking them to do. And that often helps. It seems like kind of a little simple, and really, but it actually does help motivate them to want to participate in circle time. When we look at motivation and child choice, what often happens is that we see more appropriate behaviors. They're engaged, they're having fun, they want to learn, they want to be with us. And we see less of the disruptive behavior that can be so challenging for you and for these children, less running away and less, hitting or, having meltdowns because they don't want to be engaged. So this has been a really helpful piece for us to really look at when we're trying to help kids learn. Another piece that Dorothy briefly mentioned was varying the task. And so what that means is that just going along with the idea of following the child's lead. When you're going and you're looking at your child and thinking, how do I help them learn to say their first words? Well, they might be really motivated to say their first word for cookie during their mealtime. But then they start getting tired of cookie. So they get down off their chair, and then they walk over towards the TV, and then you can teach them to say their first word to request on for TV. So you're varying up the way you're teaching. You're teaching the same idea of saying a word to get something, but you're varying it up. And this is really helpful because they're more motivated. They don't want to keep requesting cookie, say, because they're tired of cookies, but they're really interested in trying to say a word to request the TV on, or trying to say a word to request balls or balloons. So you're varying it up. And responding is better because we've got them more motivated. They continue to want those things, and they continue to respond to our opportunities, or to our opportunities for them to communicate to get things in return. I mentioned this briefly already. Balancing tasks is also a really helpful thing to look at to motivate kids. So we know, you want your child, say they're learning to say 2 words. They've got 1 word down. They're saying that pretty consistently for lots of things, and you really, really want them to start saying 2 words. So your natural inclination is likely to say, they said 2 words once, I want them to say 2 words all the time. But what happens when we expect sort of this really high level of, that's pretty hard to say it all the time if you've only said it once. What happens is that they get frustrated and they leave. They don't want to do something that's really hard for them. So what we try to do is balance it. So do, say, to continue with my example, 1 word, 1 word, 1 word, 2 words, 1 word, 1 word, 2 words, 1 word, 1 word, 1 word, 2 words. So you're balancing the easy or already learned things plus with a hard one every once in a while. And over time, those things that were harder start to become easier for them. So you're balancing it. And the obvious benefit to this is that the kids feel good about what they're doing, that I can do this, it's not too hard. So you're helping them feel successful about doing something that's really difficult for these kids. So we want to keep it feeling good and successful and really something that they can do. So we see when you do easier things, they're more interested, they're more motivated, and we see less challenging that disruptive behavior to leave. And we often see that disruptive behavior when we're creating situations that are too hard for them. So we try to balance it. Okay. Contingency really is an important area in PRT. It's just an important teaching principle to be mindful of when you're trying to help your child learn new skills. Basically, the idea is that you want your child to understand that good things happen when they do what you want them to do, which is to communicate. So, just to put it into context for you, you have your little boy, say, is using all kinds of behaviors to request that drink of juice. He might grab, he might hit, he might bite, he might not respond. The behavior that you want, of course, is that he says juice. And so what we would want to do is to help them learn, when you say juice, you get juice. But when you hit and you grab and you don't respond and you kick, you're not going to get juice for those behaviors. So you're helping them learn that when you do the thing that is so helpful for you to do, which is to communicate, when you do that, the natural consequence of getting the thing you want will follow. But when you do these other behaviors, you're not going to get reinforced for that. You're not going to get the thing that you want. So it's really helping them learn. And as kids are learning to communicate, they will, especially the kids that we're working with or your children with autism, it's hard for them to communicate verbally. So they're going to try lots of other ways to communicate. And it's for us to help them learn what that appropriate behavior is. Once they learn that, oh, I have to just say a word, the disruptive behavior, the challenging behavior goes down because they've learned another way and a more appropriate way to get across their needs. So finally, you have your child, they've said to you, "Ju" for juice. You're really hoping for juice, but they said "Ju," and that's a really good try. You want to reinforce that. So give them the juice and say, "Juice." You're reinforcing them for trying, for doing something that's not easy for them. Just because they may have said juice once before doesn't mean that every time juice is going to be the natural thing that they say. So you want to reinforce their attempts at trying to communicate. And what happens is often with the kids, they become closer and closer able to produce that word that we're looking for. And by reinforcing their attempts, reinforcing their trying, they respond. They start to respond more. They're learning more, and we're focusing on what they are doing, on what they are learning. Okay. Finally, the use of natural reinforcers. Dorothy mentioned briefly. We use things that are directly related. So, if your child is running, the natural reinforcer for them to, when they say run, is to run. So they run around. And then they go to the TV. And you might say to them, TV. They say TV, the TV goes on. That's the natural reinforcer to them saying TV. And then they go over to the Dora toy that they have, and they say Dora, and you give them Dora. So it's all directly related. And that's helping them learn that connection of, oh, I said Dora, so that means I get my favorite toy. Or I said TV, that means I get to watch my favorite TV show. And so you're helping them learn that connection, and that's a really important piece.
A lot of what you're going to see with pivotal response treatment is really watching and following the child's lead, because what we recognize is that if the child is really exploring their environment and we can reinforce that, then they will learn more. And we want to push them to look around in their environment. And we can do that, and we're doing that because these children don't often look and explore in their environment. So we're recognizing that's an area of difficulty for them. And it may be because they haven't been successful, we're not sure, but we know that there's less of that exploring happening and less of that independent learning. What happens is that we then feel that we need to be the teachers and that we're focusing so hard on teaching them things, whereas what we would like to have, just as typical kids do, is we would like them to teach themselves. I'm sure, when you watch a typically developing child, you don't have to teach them everything. They are actually picking up on a lot on their own just by trying and exploring. So that's an area for kids with autism that is more difficult for them. So we really want to focus on that. The ways we can do that are, just as Caitlin was explaining, that if a child is going towards the TV and we're following them and we're starting to do some learning around what they're interested in, they actually are encouraged to continue to approach things, not just to talk to me. That they're actually realizing, wow, if I go over there, I might get something or learn something from that too. So you're actually not just reinforcing their talking, you're actually reinforcing them taking the initiative to go find something that they're interested in. We also, the Kegels really focus on communication, and so one of the areas that they recognize with children with autism is that they, and again, I'm just being global, not all children, but a lot of them weren't asking questions. They were responding to us a lot. So I could say, what do you want? And they could tell me, but they weren't coming up to me and saying, I need to go to the bathroom, or I need a drink of juice. So, and they weren't asking me questions that, there was something there, a toy that was very interesting, but they didn't know what it was. A typical child, even at a very, very early age, is going to go, that, wanting to know what's that. The children with autism aren't asking us those questions. So a typical child is learning new vocabulary. When they're pointing at something that interests them and asking that, what that, I'm then able to tell them a new word and their vocabulary is increasing. Whereas if a child doesn't ask questions, their vocabulary isn't increasing, they're not learning new things. And they're not also able to point out to me what interests them, because it's not always possible, right? So asking questions is an area that we really look at ourselves with our children, try to figure out, is this a child who needs to learn how to ask questions? It typically is a child who has more than 2 words, usually moving into the 3 and 4 words, and could have a vocabulary of about, I think it was 50. Now, I mean, that's all, you know, they only have limited research, but that's generally a benchmark. But that's the idea, is that these children, in terms of communicating, if they can ask questions, they can start letting us know what they want and what they're interested in by communicating to us. They also approach and attempt, we want them to approach and attempt activities independently. And as I said, it could be that you're teaching them communication, and just by following them and looking at what they're interested in, they start to realize that those approaches are okay, and it's okay if that adult follows me around and shows me new things. And they start to be able to, once they start to recognize that even the interactions with an adult are more successful, then even if I start showing them new things, they may or may not get interested right now, but they might approach it later. And if they do, we are going to go and reinforce that as quickly as we can. So it's something that overall we really focus on, because we recognize that these children will be more able to teach themselves things in the long run if they feel that they can explore their environment. And the Kegels have shown through some of their research that when children do these self-learning strategies, the children are more likely to decrease their gaps in language or social development. So for requesting, Caitlin gave some really nice examples of children requesting things and learning to request. For children with very few words or word attempts, reinforcing their request leads to them requesting more often. And like I said, that's them telling me what they want instead of me saying, what do you want? Again, the goal is for that child to independently request what he or she wants, rather than having others having to ask them or having to figure it out. I know, you know, even for really small children, you're often watching to see, okay, what does he want? Okay, he's having a temper tantrum. Is he hungry? Does he need his diapers changed? Is he thirsty? Has something upset him that you're constantly trying to figure out? But if you have a child that comes up to you and says, "Chew," you've got a better idea. So, it's something that requesting makes that child more able to be successful quickly with you, makes it so that they're telling you what they want rather than waiting for you to figure it out, and that they don't have to just wait for us to figure things out. Question asking, like I said, helps the child get new information and things they're interested in. I can teach a child, if I wanted to increase a child's vocabulary, I could go around and find all sorts of objects that I think would be of interest. But if they're not interested in those objects, they may or may not learn them. I think we've all done spelling bees, so I'm sure you learned lots, but you can also forget a lot. If it's not relevant and interesting to you, if you don't use these words in your regular life, then you're going to lose them. So that's what we look for with these kids, is if they're actually asking questions, asking what is that, or who is that, or where is something, they're becoming more and more independent, and they're the ones directing their learning. The nice part about teaching a child where is it is that you can actually also teach them things like it's under your bed. Under suddenly becomes an important word, or it's in that box over there. So there's where is a nice question, because it gives you an opportunity to teach other types of language like prepositions. Now, I had forgotten, I'm sorry Caitlin, I was going to bring an opaque bag. I didn't even know what opaque was. I guess I didn't do all my spelling bees. Except what are we going to put in it? Something really boring. Yes. How about, here we are. Okay, so we're going to give you a little demonstration here. So Caitlin is the child, and I want to teach her what's that, but she's not saying what's that right now. So I need to teach that to her. So what I do is I take a bag, opaque, meaning you can't see through it, and what I've tried to do is put all sorts of fun things in here that she would really like. So I'm disappointed because I didn't get to bring any of my toys, so oh well. So we're going to pretend. Everybody's going to pretend. So I've got in here something that Caitlin really, really likes, but she doesn't know what it is. So what I'm going to say to her is, first I'm just going to show her the bag and see if she says anything. And oh, she looks like she wants to see what's in the bag. What's that? She's still not getting it. Say, what's that? She's still not saying, so I'm going to try it again. What's that? Dat. Okay. It's SpongeBob. So, sorry, these are my glass cases. So I love working with kids. You get away with these things. So you would continue now. You would keep lots of prefers. You'd have more, and we would get. So even if Caitlin had just made a little noise, I would have pulled it out. Yes, it's SpongeBob, and I would have continued. Then I would have all sorts of fun things in here. The best thing is not to put anything they can figure out. If you have bells in there, they go, bells, after you say what's that. So not a good idea. If they don't know what it is, you know, they're gonna try to say something, but they're not sure. If they know already how to imitate you, which is what I was doing with Caitlin, was modeling what's that for her to imitate. That's the best scenario. And then after a while, you continue to play the game, but you put things in here that are less relevant to her. So when she's saying what's that, because she goes, oh, that's a fun game, I remember that, you might put every third one as something kind of neutral, no big deal, you know, nail clippers, whatever, you know, that kind of thing, so that, you know, she gets the idea, okay, well, we're still playing the game, but every once in a while I pull out the bubbles or the fun stuff too. Over time, what we want to do is get rid of the bag altogether and just have somewhere some things that are out, and for her to see something new and say, what's that? And that's the long-term goal, is for her to be asking, and hopefully they aren't boring things, but they're things that she finds of interest, and asks the question, what's that, over time. This is just a nice little strategy that the Kegels have outlined in one of their books, and taught us directly as well. There may be other ways to teach these kinds of questions. This is just a nice example that shows how you try to build in something motivating by putting really fun items in this bag, but then you make her communicate for it so that she can get the fun items. And over time, you've taught her how to ask a question, which is the important part. So, there you go. So in the early query, child used this as a natural way to learn, and it actually does increase their vocabulary. Typical children's vocabulary increases this way, and this also works for children with autism. It doesn't have to be specifically the bag technique, but there are other ways. In terms of teaching independent approach and attempts, we have a number of our kids, they may have great language, and you know, so far a lot of our examples have been about children who have little or few words or little words, but in our program we have a number of kids who could probably talk me, you know, out for sure. They have great vocabularies, can discuss chess with me, that kind of thing. They're way ahead of me on that one. But some of the kids are actually very restricted in terms of what their interests are, that they might be, you know, I'm sure a few of you know some Thomas lovers or Dora lovers, that kind of thing, where it's very difficult to get them to move beyond those restricted interests, and they have ways that they like to do them, and they get very upset if you try to change them. So we will work on that, and we actually will reinforce when a child changes the way they play with something. So we'll set it up so it might be easy. You can set up so that a child is playing with Thomas, and then every once in a while you bring in something else. You bring Dora in there. Why not? Dora can go for a ride on the train, can't she? So, you know, and if at first the kids are kind of not okay, and then you take Dora out, and now they're okay again, and then you bring Dora back in, and after a while they're bringing Dora in, or they're bringing other characters in. So we really work to help them learn that other things are okay. They're seeing us do it. In the end, when the child starts bringing the things in, we're going to really reinforce them for that. We're going to make sure we bring a couple of Thomases in there, or make sure he gets extra pieces, that kind of thing, of his train set, so that, you know, he really knows, okay, that was something that is worthwhile. Half the time they start to do it because they become more interested in it too. It's changed things up for them, and they become very interested. So, in some, again, applied behavior analysis is an evidence-based intervention for children with autistic spectrum disorder. Pivotal response treatment is a type of applied behavior analysis. It targets pivotal areas like motivation and self-initiated learning, and it leads to other gains as well. There are strategies like choice, we've talked about, balancing easy and hard, and reinforcing initiation. So, one thing I'd like to suggest to people too is this is a book that Lynn Cagle and Claire, I don't know how to say Claire's last name, but Claire's a parent, and it's a really nice book. It's fairly easy to read, and it's a really nice introduction to pivotal response treatment. There are other books, but I tend to recommend this one because I just find it myself much easier to read. So. It's not so, so-and-so in 1975 did such and such sometimes.
And the other thing is it does give a parent's perspective as well. So it's back and forth between Lynn and the mom of a child with autism, and they both contribute. So it's helpful if you're a parent, I think, just to be able to relate to another parent writing about their experiences with PRT with their child.